In this video, we will see what is carpal tunnel syndrome, what is happening in carpal tunnel syndrome. Most of the people know what nerve it is. It is a median nerve that is getting compressed in the carpal tunnel syndrome. If you are someone, a patient or a physiotherapy student who is trying to understand this, what is carpal tunnel syndrome, you are in the right place. So I wanted to make my videos that is both beneficial for the patients and the students who is trying to understand this. Most of the things we are explaining here will be in a common man term, so anyone who's watching this video can understand. If you're first time here, please consider subscribing. It's going to help you. Anyways, carpal tunnel syndrome, basically what happens is actually everything happens here only. Okay, so what happens is actually we have a nerve called median nerve, and that median nerve actually travels to this area and supplying all this area. Okay, so what happens is this median nerve actually travels through a tunnel. Oh my god, there's a tunnel in your hand. It's actually formed by the anatomical structures around them. So basically a tunnel, through that there is median nerve going. So if that tunnel compresses for any reason, then median nerve get compressed between them, and you will start to experience numbness, pain. Then after some time, if you are not going to see any doctor or physiotherapist and not doing any exercise, you will get some deformity called thumb deformity, usually seen in median nerve injury. So basically that means your median nerve has been compromised and there's something really bad is happening to your median nerve. Carpal tunnel syndrome, median nerve passing through a tunnel, getting compressed, you're getting problem. Let's see the anatomy. Because if you want to understand what is happening, you need to understand this picture right here. So basically my hand is like this, I put it like and cut it like a cake. So this is my fingers, these are my fingers, these are my fingers, and I cut it like a cake. My hand is like this. So what are the structures? So different, first you need to understand this blue thing, right? This is actually we call carpal tunnel. This carpal tunnel actually formed by the borders, the anatomical borders. That is the most important things we need to understand here. What is the anatomical borders of carpal tunnel? What is the content of carpal tunnel? So what is the borders of the carpal tunnel? See, transverse carpal ligament. So it will come around in the top part. My God. So if I place my hand like this and I cut, so you are seeing this part of my hand. I don't know how to put my hand like that, but this area you are seeing cut. So in this top area, there is transverse carpal ligaments. Very important one. These are the transverse carpal ligament. That is the top border. Transverse carpal ligament is actually a part of flexor retinaculum. What is flexor retinaculum? I told you, transverse carpal ligament is a part of flexor retinaculum. What is flexor retinaculum? Flexor retinaculum is between the, actually a sheath is there. So that sheath travel from this is pisiform. Then here is the hook of the hamate. From that part it comes here and give to the, here it will give to the scaphoid PCM, right? So I will draw how will it come here in my hand. So this is the pisiform, this is the hook of the hamate. Here is here is the scaphoid, and here is the trapezium, right? So enter this area it's covering. This is the flexor retinaculum. One of that flexor retinaculum part of flexor retinaculum is transverse carpal ligament. So see here I am putting this one. Oh my God, between the hamate and trapezium, pisiform and the scaphoid. So this is my flexor retinaculum. Part of the flexor retinaculum is actually the transverse carpal ligament, the upper part of the tunnel. Now see the convexity of this thing, carpal bones. Carpal bones as basically inside here it is inside my hand, inside my lower part it is made up of carpal bones, right? This is my carpal bone in this area. I will show my carpal bones also. This is hard. Okay, so this is here in this area. If you touch and feel, you can see the carpal bones. In that carpal bones actually form the lower convexity border. So the upper part was made up of what? Transverse carpal ligament. So the borders, the upper part transverse carpal ligament, the carpal bones, hamate, capitate, trapezoid and the trapezium. So these will form the lower border. And if you see between this carpal bone, there is ligament that is called intercarpal ligament. Very important. These two ligaments you should remember when you think about carpal tunnel syndrome. That is transverse carpal ligament and intercarpal ligament. Why you need to remember this? Because these ligaments actually maintain the convexity of the carpal tunnel. It maintains the convexity of the carpal tunnel. So if any problems happen to these ligaments, the convexity of the carpal tunnel can be compromised, right? So that might be a reason for compression of the median nerve. So you got the borders of the carpal tunnel. What is the borders of the carpal tunnel? Carpal tunnel is actually made because of the borders. So the upper part, it is the transverse carpal ligament. Then down there is different carpal bones. What are the carpal bones? There is hamate is there. Then there is capitate is there. Trapezoid and trapezium is there. And between this carpal bone, intercarpal ligaments. So transverse carpal ligament, intercarpal ligament, and the carpal bones. Now, what is the content of the carpal tunnel? So inside, because of this border, there is a tunnel formed. That tunnel we call it as carpal tunnel. What is the content of a carpal tunnel? Very simple, you can remember. There is actually 9 tendons and 1 nerve. 9 tendons and 1 nerve. What is the 9 tendons? FDS. FDS is for this action, right? Flexor digitorum superficialis. Flexor digitorum superficial. Then flexor digitorum profundus. Profundus is going to the end, deep. So total 4 tendons. 4 fingers. 4 fingers. 4 superficial and 4 tendons. So 8 tendons there. Then one more tendon in the end. This is flexor pollicis longus. So the contents of the carpal tunnel are flexor digitorum superficialis, this action. Flexor digitorum profundus, only the end it is connecting. Then flexor pollicis longus, which is pollicis means going to the thumb. So tendons, for flexor digitorum superficialis tendons, for flexor digitorum profundus tendon, and the flexor pollicis longus tendon. And one more structure, most important, no one will forget, that is the median nerve. So 9 tendons, 1 nerve, median nerve, right? That is the content of the this one, carpal tunnel, right? So this is the main thing. And if you see here in the top, there is ulnar nerve and ulnar artery, and here is the radial artery. So this is so important to understand the carpal tunnel anatomy. So usually what happens is the median nerve get compressed here, and this usually get compressed to the this one only, transverse carpal ligament. So some surgeons actually remove that transverse carpal ligament to reduce the compression also of the median nerve. So you don't want to go for surgery and all, right? So there is certain exercise that you can do to reduce your chances of getting carpal tunnel syndrome or the pain you're feeling. There's actually some exercise that you can follow. Now, should I teach you the exercise? The question is, I won't teach you the exercise. If you're someone who's a patient, you need to visit a physiotherapist and get a proper this is only just for the patient education. This is for the education of the students. Treatments, you need to go visit, consult a doctor, consult a physiotherapist, and start your exercise. There is solution for carpal tunnel syndrome. Keep moving and stay healthy. Thank you guys for watching. See you in the next video. Until then, it's a goodbye from Therapist Leonard.